I think that our program in particular is very focused on learning. There are a lot of residency programs that sort of stress you out. They make you work, long hours, taking on a lot of responsibility. And though we get plenty of responsibility here and we do work hard, the focus is always on the fact that we are residents, we're here to learn, we're here to become the physicians that will be comfortable working on our own. Work never gets in the way of our learning, which is fantastic.
Our attendings just do such a great job at creating a positive environment where they encourage learning. I really don't know how to explain it. I always laugh with some of my attendings and I say, how are you making learning so fun? I don't know how they do it, but they do.
One thing that I really like about our program is our strong didactics curriculum. It's clear that our faculty is extremely invested in teaching us and putting together strong presentations every year that are really catered to us. And our curriculum is structured in the sense that over second year, they really do an excellent job preparing us to feel ready and confident when we enter third year. And I think that building curriculum year to year from first as they prepare you to second and second into third, I really think it's strong how they do it, and I think that's an important advantage of our program.
I think the thing I like most about the environment that we're in is the diversity that comes with being at different sites. Friends Hospital is definitely, it's an urban hospital. We see patients who are very sick, who have been chronically ill, a lot of homelessness, a lot of sort of very chronic substance use, and a lot of trauma. That is a very different demographic than what's going to be sort of in the rural hospital at Phoenixville, where it's more of a community hospital. We might be doing slightly different work, but I think between the diversity of the cases and the fact that our core faculty, no matter where we are, we have that support behind us, no matter which site that we're at, is something I really like about our environment.
We have 8 residents in every class, and I think that's the perfect amount of residents. I have some friends in other programs that have 20 residents per class and others that have 4. And I think when it's a larger class, you can kind of get lost. And when it's a smaller class, then all eyes are on you, but we're right in the middle. It gives us the chance to get to know everybody and know our faculty one-on-one really well. When it comes to letters of rec, it's very easy to ask them because they work with us so closely.
So one really cool thing that I've gotten to do was be part in the admissions committee this year, and I think that was a really cool experience because we got to see the incoming applicants and what they're looking for in a program and kind of match it up with our values and ideals and what we're looking for in the different applicants, that our faculty kind of gave us that opportunity to get to see what it's like on the other side of things. And I think it was a valuable learning experience.
So I am a little bit biased. I have been to, tons of cities across the US. I studied abroad in Europe and saw, many of the famous European cities. I gotta say that Philly is probably my favorite city by far. You get such a wonderful mix of diversity in terms of, population, food, music, whereas in other cities where you might find that sort of things, it's also a lot more expensive. So Philly is extremely accessible as a city. And then the other wonderful aspect of this program is that because we are in places like Coatesville, Phoenixville, sort of to the west of the city, if you are like a big nature person, if you love hiking, if you love outdoor sports, everything's there. If you do love, food, then not only do you have all of the restaurants of Philly, but you have all of the wonderful farms, of this area. Anything that you could possibly want, you'll be able to find here in a reasonable distance, and that is something that I very much appreciate.
I think to be a great psychiatrist, you need to know how to do both therapy and prescribe medicines. The gem of this program is the psychotherapy training, in my opinion. And I think that learning from Dr. Sudak and Dr. Fallon, where you get a combination of both CBT and psychodynamic training, is really going to make you a well-rounded psychiatrist, and ultimately it's going to make you the best clinician that you can be for your patients.